Okay, let's see if this works. Okay, I think this is it. All right, so this is my final presentation on scaphoid fracture. All right, so scaphoid fracture by me, Eric Pring Jr. All right, so start off with an introduction. So of all the carpal bones, the scaphoid is the one that's actually most commonly fractured. It's located on the radial side of the wrist, and it actually also serves as a bridge for the distal and proximal carpal rows. And a good majority of the scaphoid is covered in cartilage. I think it's about 80%. And the ligaments that surround the scaphoid are what provide it with its blood supply. All right, next section, move on to anatomy. So the scaphoid is considered to be the most important carpal bone of the wrist. And there are two main ligament groups. You have the extrinsic group and the intrinsic group. And in the extrinsic group, you have 3 deep radiocarpal ligaments. And these 3 ligaments, they're responsible for, they connect the capitate, lunate, and the scaphoid bones to the radius. All right, and the scaphoid also lies on top of the radius and is next to the lunate. As you can see right here, scaphoid, there's your radius and your lunate. And so, yeah. And the scaphoid and lunate, they work together and contribute towards capitate motion during any wrist or during wrist flexion. So for etiology of scaphoid fractures, there's 2 types of trauma to know about. You have the first one being low-level trauma. Examples of this are like falling from standing height, from like tripping or just falling. High-level trauma is the second type, and examples of these would be something like more serious, such as a car accident. And with scaphoid fractures, usually the most commonly way they're fractured is by low-level trauma, and it's by falling on what's outstretched hands, or foosh, also known as it. And so when you fall on outstretched hands, the scaphoid is compressed between the radius and the second row of carpal bones, which is ultimately ends up resulting in the scaphoid fracture. And then other complications that go along with scaphoid fractures include swelling, severe point tenderness, pain with any axial loading of the thumb, and scaphoid fractures kind of to follow along or to follow that up, just pictures of both how it looks like visually looking at a hand, and then you got like x-ray image. And then going back to foosh or falling on outstretched hands, here's an example of a player. Actually, I think it'd be easier if I do this. Yeah, okay. Cool. We can watch this really quick. And so foosh, usually they'll fall forward. In this case, the athlete fell backwards and his hands were still kind of outstretched, but you'll see. Oh. Okay, there we go.
The layup, and as you can see him coming down here, he basically falls and braces his fall by landing on both of his hands, specifically here now causing injury to that right wrist. We call this pattern of injury a foosh mechanism, fall on an outstretched hand. Usually someone's falling forward and they basically reflexively put their hands out to brace their fall. And as you land, that load from you falling gets transferred up through the bones of the wrist and can cause a wrist fracture. So here's Lamelo's coming down, all of his body weight and momentum is carrying him into the ground. and he's bracing that impact and transferring that load through his hands and wrists. Specifically here in this position, you can see his wrist is in an extended position, meaning it's pointed up like this, and all of that load's going to be coming through his radius and the ulna, primarily the radius in his forearm, to help brace that fall. And this is going to be the
Should be good. Go back to. Let's see. Yeah, okay. Perfect. Next, we have diagnosis and treatment. So to get the most appropriate and diagnosis for a scaphoid fracture, a computed tomography scan, also known as CT scan, is usually what's required or preferred. They allow for a more detailed look compared to something like X-rays, more accurate. For a little bit of some treatment, early fixation following a scaphoid injury helps in the long run to help basically successfully achieve and regain full function of the wrist. Cryotherapy or just applying ice or as soon as possible, whether you do fracture your scaphoid or even if it's suspected, is highly recommended and preferred as well. And also the affected area should be splinted until the athlete is able to be seen by a physician. Continuing with a diagnosis and treatment, in most cases, surgery does end up being required for scaphoid fractures. Usually, if the fracture is displaced or there is non-union, surgery will be required. Ultimate goal of surgery. So the ultimate goal of surgery is to achieve bony union and fix any deformities, prevent arthritis and progressive carpal instability. And for non-surgical treatment, if a scaphoid fracture is non-displaced and non-union is not present, non-operative, non-surgical treatments can work just as fine, such as examples of that would be just cast immobilization. Before we move on to rehab, with cast immobilization, it can last about 6 weeks, and then afterwards we'll hop into rehabilitation exercises for stretching and strengthening. So for rehabilitation exercises, 3 stretching ones. Well, you have a wrist flexion stretch. So basically to perform this, you just bend the wrist forward gently, hold for 5 seconds, shown on the right, the very top picture. And usually this is preferred to be performed for 2 sets of 15. And then for all my exercises, the preferred sets and reps are all going to be 2 sets of 15. For a wrist extension stretch, which is going to be the middle picture, bend the wrist slightly backwards. You also hold that for 5 seconds, 2 sets of 15. And then you have the side-to-side wrist stretch. And you're going to supinate your wrist and place it as if you're going to give a handshake to someone with the thumb facing up. Move wrist side to side. And repeat that for 2 sets of 15. Now for strength exercises, it's going to be fairly similar. Starting off with the first 2. So like for wrist flexion strengthening, you'll hold a weighted object such as a dumbbell and you do the exact same thing, but rather than holding it for 5 seconds, just like a 1 second pause at the top will be fine. So hold a weighted object such as a dumbbell, the palm facing upwards, bend the wrist upward slowly, repeat for 2 sets of 15. Wrist extension strengthening, you're gonna hold a weighted object again with the palm facing downward, then you're gonna bend the wrist upward slowly, and repeat for 2 sets of 15. And then another strength exercise for rehabbing a scaphoid fracture It's actually super beneficial to strengthen the forearm with supination, with this supination and pronation strengthening exercise. So you're gonna hold a weighted object once again, such as a dumbbell. You're gonna end up bending your arm 9 to 90 degrees, and then you'll turn your hand while keeping your arm at 90 degrees. You'll turn your hand slowly, and switching it so that your hand will be facing up and down, and you'll just repeat that for 2 sets of 15. And yeah.